Hey everybody, Dan here with Pain For You. Today's topic is going to be chronic pain. Can it be TMS and structural? Right, because there's a lot of people trying to figure that out because it feels so structural. So, we'll take a couple of nice deep breaths. It's Halloween when I'm recording this, so it'll be November 1st when you watch. Welcome to November. Let's take a couple of nice deep breaths. Breathe in the crisp fall air. It was 28 degrees when I woke up. Fortunately, it's about 40 now. Breathe in the confidence. Exhale the doubt. Breathe in the knowledge. Exhale the uncertainty. All right, so chronic pain. Can it be both TMS and structural, right? Because some people feel like, well, I did have a structural problem that got this whole thing started. And there's a number of concepts that I want to cover here today. First of all is the body heals. The body is designed to heal. If you've ever cut yourself or burnt yourself, you can literally watch it heal over the next several days or a week or two at most. So the body heals. The body is not designed to stay in pain forever. All right, so that is the first concept. Second concept is learned pain, neuroplastic pain. Basically, through fear, focus, anxiety about the pain, we can teach the brain to wire it. Basically, those neural pathways become learned. Dr. Schubner wrote a great book about it, Unlearn Your Pain. So if we can learn it, we can unlearn it, right? And the way we do that is to do the exact opposite of what made it learned. So if the fear over the pain or the injury or the TMS or the onset of pain and the focus on it and staring at it all day long and freaking out about it and the anxiety about it and what it means about your future, if that's what makes it chronic, well, the answer is simply to do the opposite. Learn through accurate knowledge not to fear it anymore. Yes, it's uncomfortable, but if you really knew that there was nothing broken in your body, there's really not a lot to fear other than the physical sensation, which is temporary because you know it's TMS and you're employing this type of an approach and you know you'll get better. Right? So turn down the fear. Stop focusing on the pain all day long. And I know it's difficult because the pain will get your attention. Anytime you're moving or doing something or this or that, you're going to notice it, right? So my approach is to say, okay, whatever, I know what it is, not a big deal. If you can't get there, at least choose your response. Choose not to freak out, because freaking out won't get you better, and that'll just reinforce the brain's perception that you're in danger, that you're messed up, and you're in trouble. And it will keep the pain going as long as you keep on freaking out. So choose a calm response. So some people are talking about how, their body, their joints are out of whack. One lady is asking about her jaw, how it's like kind of dislocated. I don't know if you guys saw the pictures from me when I was all bent out of shape. Now, I could have certainly looked at the mirror and said, man, this is physical. And I heard chiropractors say, you're in pain because you're all crooked. It must be pinching something or hurting something. Heard the physical therapist say, oh yeah, you're all crooked. Wow, look at how crazy that is. Wow, I never saw anybody so whacked out. It felt and looked really structural, didn't it? Take a look. I will try to post the pictures, maybe even use that picture in the thumbnail image for this video. So it's very easy to get the perception that I'm all jacked up, and that's what the problem is. So it's structural. It's structural too. I believe that TMS and the emotions and this neuroplasticity has something to do with it, but it's structural too, right? And that's very, very easy to do because you're told that by the experts that went to MSU. That's yesterday's video if you didn't see it. And we come to our own conclusions. We literally come to our own conclusions that it feels physical. And so Here's a story. I worked with a young lady who was diagnosed with Ehlers-Danlos syndrome, which is hypermobility of all the joints and the ligaments and connective tissues and all that kind of stuff. And she had wicked pain. She had neck pain, she had pain in most of her joints, her ribs would pop in and out of place, and all that stuff was dramatically painful, right? First time I coached with her, she showed up in a neck brace. She could barely feed herself. For a while she couldn't feed herself. Why? Because she couldn't lift her shoulders, her arms up to get her hand to her mouth. She had no mobility because every movement was screaming in pain. Ehlers-Danlos. And she went into that community and was told, oh, this is awful, and the doctors would tell her, you're going to have a lifetime of pain and surgeries. We're going to fuse your neck first, then we'll have to move to your upper back, then eventually lower back, and you're going to really have a lifetime of pain. So why were things dislocating? Like her shoulder would go out, her ribs would go out. And if anybody could really attach to a structural cause, that certainly seems. But on the flip side, a lot of people with hypermobility end up in circuses as contortionists or gymnasts, and they can do all sorts of craziness with their bodies. Hypermobility doesn't necessarily have to mean pain. So what about the fact that this young lady's ribs would pop in and out, her shoulder would dislocate and relocate and everything like that? Well, TMS oftentimes causes muscle tension, muscle spasms, right? In my case, I was all sorts of crooked. Why was that? I wasn't in pain because I was crooked, but I was crooked because I was in pain, right? I would have the lower right back muscle spasm and tighten up, and what would that do to my hips? It would twist them, and that would put my spine at an angle. And then it would tilt back so I didn't fall over, and I would end up with tilted shoulders and a tilted head. And so everybody would look at that and go, wow, do you have scoliosis? Wow, you're really messed up. No. Was the crookedness the cause of all the problems, or was it the result of the problems? So in the case of this young lady with Ehlers-Danlos, it was very possible, and based on her results of getting out of pain, that's my conclusion, and her conclusion was that TMS was causing all of this in the first place. If muscle tension was pulling ribs out and they felt like they were dislocating, and pulling the shoulders out, muscle tension in the shoulders. Look, when you've got a muscle really in spasm, the joints, the connections between the bones, they don't operate as they're designed to. So for the young lady who is currently having jaw dislocation, it is very possible that is the result of TMS and not the cause of your chronic pain. It is very possible, and I'm not saying for certain, I've not worked with her and I'm certainly not a doctor, but if you've done the pain assessment and the score says TMS, right, then it is very likely that it's possible the tension in the jaw and the muscles in the face might be what's pulling the jaw out of alignment. And maybe you can hear it click or pop a little bit sometimes. And maybe they can see that there's an abnormality in the jaw joint, right? But again, that's no different than a doctor finding on MRI that there's a bulge or a herniated disc, or there's a minor tear in the meniscus or the rotator cuff, right? These things are seen on the imaging studies, but for the most part, they're normal abnormalities. So it's very easy for us, very easy for the doctors to make the claim that, yep, I can see a physical cause, so I have a physical problem. Talked to a lady who had surgery 3 years ago. She was convinced the surgery was botched. Why? Because she still has pain 3 years later. The surgery likely wasn't botched. The MRIs post-surgery said, it's healed perfectly. There's no reason you should have pain. Other than the fact that she regretted the surgery, she didn't want it in the first place, she was fearful it wouldn't heal right, and her brain got so fixated on the pain of the surgery and her fear that it wouldn't work, the anxiety of the future of it not healing properly, that she literally taught her brain to wire those neural pathways, and it kept the pain persistent, which then fed her belief that the surgery was botched, based on the evidence of pain 3 years later. And so, this woman might argue that she has a structural problem and TMS. Well, look, again, surgeries heal, injuries heal, the body heals. Any pain that lasts longer than the healing time frame is learned pain, which is essentially, a synonym for TMS, or mind-body syndrome, or this psychophysiological pain disorder, or this stress illness, right? Anything that lasts longer than the normal time frame for a body to heal is learned pain. So if you ever get a true injury, your number one job, which I talked about a couple of days ago, was calm down. Trust the body, it's going to heal. If you get a surgery, trust the body, it's going to heal. Right? That's what the bodies do. If you take reasonably good care of it, the body will heal. And look, it's amazing. If you don't believe that the body is infinitely capable of caring for itself, take a look at people who abuse their body with cigarettes, alcohol, junk food for most of their life, and they're 400 pounds at 60 years old. The body is still finding a way to keep them alive, despite the fact that they've had a lifetime of doing everything possible to destroy their body and to make it toxic. So look, the body is infinitely capable. Trust it, it will heal. If you've ever had an injury and you think you still have pain from that, trust your body. If your joints and things are popping in and out and you're convinced that it's structural, trust TMS, because with me, I was all jacked up, and I'll show you that picture either in the comment or the thumbnail, probably both. Once I discarded all efforts to fix the crookedness in my body, and I focused 100% on TMS, and I was able to dial in all of these concepts that I share with you each and every day, my body straightened out on its own. The muscle tension that had my hips crooked let go, and the hips balanced, and the spine straightened up, and the shoulder tilt disappeared, and the neck tilt disappeared, and everything kind of went back to balance. Once I fixed the problem, which was TMS, these structural things that were easy to blame for all of the pain for those many years, those structural problems balanced and returned to normal and kind of went away on their own. So those are a couple of examples. The Ehlers-Danlos lady, the lady with the jaw. She hasn't gotten better yet, but I'm suspecting that tension in the jaw and the fear of movement is keeping it moving in a very unnatural way. And that fear, the perceived danger of, I got a bad jaw, everything's going to hurt, is keeping the pain persistent, which just further, compounds the fear. And so my situation, Ehlers-Danlos, the joint, there's an infinite number of cases and examples. And if you have a case where you had something that, darn it really, really looked structural, but you got better anyway, please share it below. And I'll share it with the group if it's a nice case study and a success story. But look, can it be TMS and structural? Not if the pain has lasted longer than the normal time frame for healing. So it's a good thing to look up. Some people have a major traumatic accident. They bust their body up in a car accident, multiple broken bones. And that person may take a while to heal, may take longer to heal, maybe 6 months with some rehabilitation. But eventually the body should be healed, right? And so if your pain has lasted longer than what is expected for your particular injury or surgery, then it's absolutely learned pain, which is essentially TMS. All chronic pain is learned and neuroplastic pain. And if your pain kind of came out of nowhere without an injury, it's absolutely TMS. Even if out of nowhere your jaw started hurting, right? absolutely TMS because there was no structural cause or injury, or you didn't get punched in the face, or, you know, so that kind of stuff. So is it possible? I guess there's a very small fraction of a percentage that might be both structural and TMS, especially if, for example, you broke an ankle and you just kept on walking on it and running on it, and you never allowed it to heal because you kept on re-injuring. And so I don't think that's the case with the Ehlers-Danlos syndrome. I don't think it's the case with the lady with the jaw pain. I don't think there's something there that she's continuing to re-injure. I think the fear and the anxiety and the focus on it and the tension in the face and the muscles is pulling things out of whack, which is causing the joint to not function as normal. And so my number one recommendation is going to be to breathe, relax, decide you're not broken, decide to trust and commit to this TMS approach, and set aside your skepticism. Because honestly, I'm not telling you to do anything dangerous. I am telling you to think differently, to believe differently. And that is not a dangerous thing. It's not invasive. It's not medical. It's not a drug. And I'm not telling you to, you know, try to pull a truck by holding a bit between your teeth. You know, I'm not telling you to do anything crazy. I'm just telling you to think differently and believe differently and have faith in your body. Have faith in this TMS work, because this TMS approach absolutely works. And it works pretty darn consistently when you get the things I've been sharing dialed in. So, love you guys and gals. Enjoy your, what's tomorrow? Sunday. Hope you had a nice Halloween for anybody who celebrates that. And I guess I'll see you tomorrow. Take care.